and welcome to another edition of Liquid Health News. I am your host, Jefferson Nunn, and we have just some incredible news that we're discovering in the world of toxic health news. Things that are affecting a lot of people. So, top of the list, why should you listen to me? Well, I was affected by toxins, mold, for more than 2 years. And I've learned what it means to be affected by toxic mold. We're now forming and trying to get uh, running, if you will, a care network, a way of dealing even with just some of the crazy effects of toxins in our air, in our water, in our food, in our homes. It's everywhere. And there's seemingly sometimes very little that we can do about this. There was a story I read most recently, it'll be up very soon on Liquid Health News, about a soldier whose lungs were permanently injured. He required a lung transplant due to the burning of toxic chemicals while he was serving his country. And he was really not able to uh, get enough help for his conditions. It's really a struggle sometimes to get people to understand why toxins in our environment can have such an adverse effect on our health. So, again, why should you listen to me? I've dealt with this for 2 years. I've heard doctors say no to me. I've heard nurses say no to me. I've heard people say I'm crazy and that I don't know what I'm talking about. Well, it turns out, you know, there really is an adverse effect on our health from toxins. In San Diego, Santee residents are discovering that there's toxins leaching from the landfill, those batteries that you throw away, those printers that you throw away, those computers and monitors that you throw away, all those gadgets that you throw away, they end up in the landfill. And if the landfill isn't properly contained, then toxins are going to leach from that into the water supply. And then that water supply goes back into all our homes. And we drink the very trash that we throw away. And that's what they're discovering at this landfill. How many other landfills have we tested on a regular basis to make sure that toxins from the stuff that we're just throwing away, desks and chairs made of high-tech polymers that are decaying and being leached into our water supply. In other news, they're finding out that CETA, which affects a lot of people, it's a bacteria that once it gets into your stomach, it's really hard to get rid of. And it turns out the more inflammation that you have, the more this bacteria thrives. So finally, they're discovering that people in the past, on one of the last shows I talked about chronic fatigue syndrome, how they first classified this in the 1990s. And they're finding out now that, oh, wow, stuff that we learned from the chronic fatigue syndrome is still very similar to the long haulers that, from COVID-19. So, yeah, there's a lot that goes on with all of this. Toxins in our environment, toxins in our food and our water supply, toxins in the air. And what can you do? How can you get a nurse and a doctor to listen to you and to hear your plea for help? There are ways. There are ways. The more prepared that you can be when you visit a doctor, if you have your medical records printed out and you bring them with you, and you can present that to your doctor, along with any research that you come up with that's similar to your case, that can help. But we're working on compiling a list of doctors that will really be able to help you in your time of need. So that you don't have to hear some wonky doctor that has no background for saying no, to say no, just because they're ill-informed. They don't know what they're talking about, actually. Their medical training has not prepared them for this day. The medical training that they have received is primarily, and the ER is just plumbing. If you got a broken bone, you've been in a car accident, you're torn up, they're going to hopefully put you back together. But the hospitals are not designed really to handle even what's happened today with COVID. It's not designed for long-term handling of catastrophic conditions. It's designed for short-term interventional care. Short-term, like hours, not weeks. So the hospitals we have today are just not put together the way they need to be put together. And on top of that, for most of the for-profit ones, they've invested billions and they're seeking billions in return. So for those reasons, it's just, again, not put together very well for the way that it needs to be put together. And so when you go to the hospital, when you go see a doctor, when you go see a nurse that's affiliated with one of these entities, what they're looking to do is to kind of get you back on your feet, but only if you're in one of those conditions that they know about. So, long story short, you're not going to get the help that you need a lot of times from traditional care. And that's the challenge. That's the problem. I get it. But what can we do? Sometimes it seems very little. But hopefully, as we go, more. Bring your medical records with you. Hopefully, that will help. In the interim, what else can you do if you've been harmed by toxins in your environment? Keep as many records as you possibly can keep. All right? Records are important to further prove your case. The more records that you can keep, the more journal entries that you can keep, the more that you can document what's going on to you, the better chance that you will have to handle these situations. And that is to say, the better chance that you'll be able to get in front of a doctor that will eventually be able to help you. And those records will also help when you get in front of a lawyer that could potentially help you. Documentation is important. And finally, what's the third thing that you can do? Is just to keep going. I know it seems hard. I know it seems impossible sometimes to keep going every day. Hopefully, you can reach out to somebody that will listen to you at the very least. Just talking about what's going on helps. It helps. It's not a cure. It helps. You know? Too many people have just simply met their end because they couldn't handle it anymore. Hopefully, you have a care network around you to help. As we go, we'll hopefully build more of these care networks. And we'll build a way that you can get out of the crisis condition that you're in. So, we had our show a little bit early today. If you have any further thoughts or questions, share them with us. We are here, we are listening, we're doing what we can to build a network. It takes time, a lot of energy, a lot of effort, and a lot of money is going into this to hopefully make a difference in the upcoming years to come. These are still the early days. We're the first of our kind. We're networking with as many people as we can. If you know of anyone that wants to network with us, or if you need help, contact us, and when we can make something available, we will. At the Biotoxin Foundation. And through Solve.care, we'll make a difference. Again, I'm Jefferson Nunn, and this has been another episode of Liquid Health News.